tearing is the number one fear of women when it comes to childbirth. But the good news is there are many things that you can do to reduce the risk of tearing.
Yes. So in this video, we are first gonna show you how to correctly apply a perineal massage in preparation for your delivery, because most women do it the wrong way. And we're also going to explain why it is the most effective tool to reduce the risk of tearing according to clinical studies.
Yes, and then afterwards we're also going to talk about 2 things that you can do during your delivery. This is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher and science geek.
And we're here to help you and your baby naturally and science-based. So let's jump right into it.
As the baby moves through the birth canal, the baby puts a lot of pressure on the perineum, causing it to stretch and in some cases to tear unless the medical team performs an episiotomy.
Yes, episiotomy is basically a surgical cut at the opening of the vagina, which is common practice in cases that would otherwise most likely lead to tearing. The good news is though that most perineal tears are either first-degree tears, which heal naturally, right, because they only involve the skin, or they are second-degree tears, which may require stitches because they also involve the perineal muscles. However, they normally don't cause any problems later on. Third and fourth degree tears, on the other hand, could cause problems later on because they also involve the muscles which help control the release of stools. But luckily, they only happen in about 1% of all cases.
Yes. Most importantly though, it is possible to reduce the risk of tearing, particularly the risk of those severe tears. Not only by preparing the perineum during your pregnancy, but also by things that you can do during childbirth.
Yeah, so the most important thing to do during your pregnancy in preparation for birth is a perineal massage. Now here is why we recommend to each and every woman applying a perineal massage daily from week 35 of her pregnancy onwards. A recent scientific study, including more than 3,000 women, has found that women who had received a perineal massage during their final weeks before delivery had significantly fewer perineal tears, particularly third and fourth degree tears. Moreover, significantly fewer episiotomies had to be applied.
Exactly. And on top of that, it was also found that antenatal perineal massage may lead to better wound healing, less perineal pain, and it even seems to shorten the duration of the pushing phase. And if that long list of benefits does not convince you, well, then we really don't know what else to tell you, because all that it requires is 10 minutes of your time per day and some olive oil.
Now, before you apply a perineal massage, it's always a good idea to talk to your midwife or doctor, because maybe there are good reasons why you should not apply it. Like, for example, in case of vaginal herpes, a yeast infection, a urinary tract infection, or other kinds of infections.
Yes, if you do get their approval, first of all, make sure that your fingernails are short so that you don't hurt yourself. And then find yourself a cozy corner. Initially, you may find it helpful to put a mirror in front of you, because this can make it easy for you to see if you're doing it the right way.
Yeah. Next, as Nathalie already mentioned, you are going to need some olive oil. Please don't buy these completely overpriced perineal massage products that you can find online and also in shops. You don't need them.
Right.
Olive oil, the kind of oil that you're using for cooking, is totally fine.
Now, before you start, you should keep in mind that a perineal massage may be a bit painful initially during the first couple of times. However, it's gonna get better and better every time you apply it, because your perineal tissue is gonna get softer and more flexible.
Yeah.
And that's, after all, exactly what you want, right? So first of all, clean your hands and then apply some olive oil on your fingers, particularly on your thumb of the hand that you're going to use. Next, insert one thumb about 2.5 to 3.5 centimeters, that's about 1 to 1.5 inches, into your vagina, and then gently press the 3 fingers of the same hand from the outside against the thumb that you can feel on the inside. And then all you have to do is make this twirling movement. So it's important to put that perineal tissue between your fingers and then just massage it in that twirling way that we are showing you here. What's also important is that your thumb remains in a position close to 6 o'clock. So if you imagine your perineal area being a clock with your thumb at 6 o'clock when inserted into your vagina, then you want to make sure that you massage the area between 5 and 7 o'clock with your focus being on 6 o'clock, but not further up. This is really something that most people get wrong because they don't understand what exactly happens during a delivery. And because of that, they will tell you to massage the area from 3 to 9 o'clock, but this is not how it should be done.
Yes, and the reason for that is the way the muscles along your birth canal rearrange to form a tube during your delivery. Actually, there are two tubes, right? One is the inner tube, which consists of the lower segment of your uterus, normally your cervix, but your cervix is gone by now, right? And your vagina. And then there's also the outer tube, which basically consists of your pelvic floor. Now, when you don't give birth to a baby, the pelvic floor simply consists of several layers of muscles, which together are actually really thick, like some 4 centimeters. But during delivery, those muscles are rearranged and rolled out by the head of the baby step by step to a 15 centimeters long tube. And so by massaging your perineum the way we have showed you, you make sure that the tissue in the area where the baby's head rolls out the muscles of your pelvic floor to form the tube is more flexible and less likely to tear. So we are basically working on the floor of the tube, if you will, at 6 o'clock, right? Rather than the walls at 3 and 9 o'clock, because it's the floor of the tube that will be stretched the most when your baby moves through the tube.
Yeah.
And if you now haven't understood a single word of what I just said, don't worry, I get this a lot. You can pause the video right now, go back to the beginning of my explanation and watch it as often as you need to.
Yes. By the way, you can apply the massage for about 5 minutes per day. And if you can do that from about week 35 of your pregnancy onwards, trust us, you're doing the best you can in order to prepare your perineum. But even if you can only start later on, don't worry, it's still better than not doing it at all.
Yeah, that said, unfortunately, it's not a guarantee that you will not tear, right? Because a delivery is really unpredictable. But at least it will considerably reduce the risk of tearing, particularly the risk of those severe tears.
Right. Now, what can you do during childbirth in order to prevent tearing? Well, first of all, what many women don't know is that they can also apply a perineal massage during the pushing phase. However, it's normally nothing that you would do yourself at this point. Very often it's done by your midwife, and if that's not an option, it can also be done by your birth partner, of course.
Yeah, and it can be very effective. In fact, in a recent scientific study, including more than 3,000 women, it was found that women who had received a perineal massage between or during pushing time experienced significantly less tearing and significantly fewer episiotomies had to be applied. What they could not find though is that perineal massage during the pushing phase also leads to better wound healing, less perineal pain and a shorter duration of the pushing phase. So apparently preparing your perineum during the weeks before labor comes with added benefits than if you just doing childbirth.
Yes. By the way, if it is your partner who is doing the massage, he can basically do it the exact same way as when you would do it yourself, except that this time the thumb is on the outside and the index and middle finger are on the inside, okay? But otherwise, it's the exact same twirling movement that we have showed you before. And he would also mainly focus on the 6 o'clock area. Again, no need to include the walls of your vagina.
Yes, remember, this is done either while you push or between your pushes. But of course, it depends a little bit on the progress that your baby is making, because as we have heard already, at some point your baby's head will do the stretching for you, right? So if you're not sure when to apply a perineal massage during the pushing phase, just let the midwife guide you.
Yes. Another thing to keep in mind is that not every birthing position will allow your birth partner to apply a perineal massage. Yeah. However, this should not be a reason for you to worry either, just be flexible. Finding a birthing position that you feel comfortable with is more important than the ability to apply a perineal massage during the pushing phase.
That's a very good point actually. A perineal massage during the pushing phase can be very effective, no doubt. However, if for whatever reason it's not an option during your delivery, you don't need to worry as long as you have prepared your perineum during the final weeks before labor.
Yeah.
When you are in labor, you only have one job that you need to focus on, and that is giving birth to your baby.
Yes, besides, there is another tool that you can apply during the pushing phase, which your birth partner may find easier to apply, and that's warm compresses. What we mean by that are compresses made from a clean washcloth, soaked in warm tap water and then held against the perineum during and in between the pushes. And this is something that is often done when the baby's head starts to stretch the perineum. So up to this point, you could apply a perineal massage, and then afterwards, when the baby's head is taking over, you could apply warm compresses instead to support the stretching.
Yeah, similar to a perineal massage, during the pushing phase, it was found in clinical studies that warm compresses can significantly reduce the risk of tearing, in particular the risk of those severe tears. So if that's something you want to do, make sure to include a clean washcloth into your hospital bag.
So to sum up, if you want to reduce the risk of tearing, the best thing that you can do according to clinical studies is applying a perineal massage from about week 35 of your pregnancy onwards.
Yeah, if you want to do more, then you can either continue with the perineal massage during or between the pushes, or apply warm compresses, or do both if you feel like it. In any case, the one thing that should always be part of your strategy to reduce the risk of tearing is preparing your perineum already before you go into labor, simply because applying a perineal massage or warm compresses during childbirth is sometimes very difficult or simply not an option. But you don't need to worry about that as long as you have prepared your perineum during the final weeks before labor.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like.
Yeah, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.